Well, everybody, this is Gary. Today is Sunday, March 19th, 2023. It's 3:48 p.m. Eastern Standard Time in the United States in Rochester, New York, and this is my Coping with Schizophrenia blog entry for today. Today, I'm not doing too bad. My anxiety levels are kind of high, but my auditory hallucinations are not that intense. My paranoia and delusions don't seem to be that strong today. My depression is not that severe. Haven't gone outside at all today. Just haven't had much ambition to do my physical walking therapy exercises outdoors. What I might do is just use my indoor exercise bike for about a half hour to exercise my right knee because I had surgery on my right knee last year. I had torn a meniscus in my right knee and it still kind of hurts. And the surgery was about May 13th of last year. So it's been almost a year because we're approaching March, and the pain is still there. And because it's winter, the pain seems to intensify with the cold, and that also applies to the arthritis in my back and joints. I had an appointment with my therapist earlier last week. I believe it was Tuesday or Wednesday or Thursday. I don't remember when, but that went all right. I went in feeling pretty shitty that day to talk to my therapist. I almost went to the psychiatric emergency room, but I had an appointment with my therapist, so I thought it was more important that I meet with my therapist than go to the psychiatric emergency room and waste a lot of time. I was able to feel better after talking to my therapist. My auditory hallucinations earlier or later last week were pretty intense. They were louder. My paranoia, my delusions were pretty strong. I thought people were following me, watching me, spying on me, um, plotting against me. My depression was pretty severe. My anxiety levels were very high. Um, I was very confused, angry, agitated, not violent or suicidal, but I definitely had to keep the appointment with my therapist because I was feeling so shitty and I didn't want to go to the hospital. The previous week, I had felt really bad for like 7 or 8 days, and I skipped an appointment with my peer support specialist because I felt so crappy. I also had an endoscopy scheduled for my throat and stomach, but I canceled that because I wasn't willing to be drugged and put on a table for 3 hours with narcotics and have a camera shoved down my throat. That would have just made my psychiatric symptoms worse. So they want to do an endoscopy with a camera to see if my esophagus needs to be dilated because I often get food lodged into my esophagus. Not to the point where it cuts off my airway, but just lower down in my esophagus. Sometimes food gets stuck temporarily, and I can't eat or drink anything until it moves either up or down. Um, so I will eventually do the endoscopy. I do want to know what's going on with my throat and my stomach. They want to take a look at my stomach because I use Motrin for pain, and it can irritate the stomach lining and cause bleeding. So I definitely still wanted to get the endoscopy done, but I may wait until winter passes and my mood is better. Because I get the feeling if I'm drugged up on narcotics while I'm doing the endoscopy, that's just going to make my psychiatric symptoms worse. This is why I don't like using painkillers, narcotics, opioids. Not because I've ever abused them, but because they tend to aggravate my psychiatric symptoms and make them worse. They make my paranoia worse, my auditory hallucinations worse, my depression, my anxiety, my delusions. They all get worse if I use narcotic, opioid, sedative like drugs. So I try not to use them. I have used them like when I broke my arm. I took Percocet for a month. Never got addicted to it. Not very good at controlling physical pain, anyways. I've also taken opioids for 2 or 3 days after my knee surgery, and sure enough, I ended up in the psychiatric emergency room. So I generally don't like taking opioids for pain because they tend to aggravate my psychiatric symptoms. Um, I've already meditated twice today. I did some work on my computer. I do consumer surveys for extra money. And I decided to go ahead and make this video. I haven't made a video in 4 or 5 days, I don't think. So I thought I'd go ahead and make a video and just do a check-in real quick. But I'm okay. Not much else to report on. I am seeing my peer support specialist this week. I am seeing my therapist the week after that. I'm trying to see at least one counselor once a week, and I have 2 counselors and a psychiatrist. The psychiatrist, I believe, I'm seeing in the first week of April, once every 4 weeks or so, just to go over my medication list. I still have an appointment with the pulmonary specialist because I have pulmonary fibrosis, which is scar tissue that forms in the air sacs of the lungs, which makes it more difficult to breathe. And I don't know how severe it is. And so I'm seeing the peer support, or not the peer support specialist, the pulmonary specialist on March 28th. They're going to run a test on me, and then I'll have an appointment in a half hour after that with the doctor, and we will discuss how severe my pulmonary fibrosis is and what might be causing it, and if there are any treatment options for it. I don't think it's from smoking cigarettes. I haven't had a cigarette in 15 months, and the pulmonary fibrosis showed up about, 2 months ago on my CAT scan that I had of my abdomen. It also picked up my lungs on the scan, and it showed that I do, in fact, have pulmonary fibrosis. So I don't know what's going on with it yet. Well, pulmonary fibrosis has nothing directly to do with my schizophrenia or my schizoaffective disorder, but it definitely impacts my mood and my health. If I walk long distances, I get out of breath very easily, which is a common symptom of pulmonary fibrosis. But that's all for now. Like, comment, share, subscribe.